I'm Dr. Sandy Baird, owner of Riverstone Chiropractic here in Oakland, California. Anytime the load that's placed on the body is greater than the capacity of the body to handle that load, adhesions are the result. So here's what I mean. Let's take a quadricep muscle, for example. A lot of times clients will come in with knee pain and they'll say, my doctor told me that I just have arthritis in my knee. There's not much that I can do about it. Am I just going to be in this pain for the rest of my life? Well, what can you do about it? And the way I look at it is that there's a lot of muscles that are involved in making the knee work. So there's muscles that extend the knee, there's muscles that flex the knee, there's muscles that help the knee rotate and move side to side. And any one of these muscles can get overused. So let's talk about the quadricep muscle, just to pick an example. So typically the quadricep muscle can handle a certain amount of load. You can run a certain amount, you can swim a certain amount, you can run around with a weighted vest and squat 500 pounds if that's what you do, but there comes a time where the quadricep muscle just cannot handle more load than that. So that's its capacity. If you think about it, it's kind of like a seesaw, right? So if you have a really light load and the tissue has a really strong capacity, that's good, that's healthy tissue. But if you start to overload the tissue, all of a sudden the load is turning the seesaw this way. Not so good. That's when you have dysfunction. So anytime the muscle gets overused or overworked, whether it's an acute injury such as a fall or a crash, or whether it's a more chronic, insidious, repetitive injury such as chronic poor posture, sitting at a desk for a long period of time, repeated motions, things that lead to carpal tunnel, anything like that, the involved tissue, in this case the quadricep muscle, is not getting enough circulation. So wouldn't it follow that if a tissue is not getting enough circulation, that it's not getting enough oxygen? Yes, yes. So the tissue now has decreased oxygen, which we call a condition called hypoxia. The hypoxia creates an inflammatory condition in which adhesions actually lay down in the muscles. So how do we fix dysfunction? It's simple, really. We either need to decrease the load or we need to increase the tissue capacity. There's a few ways to decrease the load on a tissue. The first one is reducing mileage. If you're a runner or training for an event, cut back on the mileage. Make sure you're not doing too much too soon. Make sure you're taking rest days, being conscious about any changes in trail surface or road surface. The next one is improving posture. When you have good posture, there is less load on the spine. Maybe even consider getting a standing desk if you're sitting 8 hours or more a day at work. What this does is make sure that the hip flexors are not always in a shortened position, so they have a chance to lengthen out. This will improve the biomechanics of the body and make sure that there's as little knee pain as there can be. If needed, lose weight. And then in terms of repetitive tasks, there's not always that much going on for the lower body. For the upper body, this might be things like typing and computer work. The lower body, just being conscious of things like driving a stick shift, if there's any way you can reduce the amount of driving if that is inflaming your knee pain. And just remembering that sitting itself is a repetitive activity. There's no rest period in sitting, and your body is, or that is your hip flexors, are in a sustained contraction. There are several things that you can do to increase the capacity of a tissue. Avoiding cigarette smoke and other environmental toxins is the first. You can also make sure that you have plenty of antioxidants in your diet, so any of the colorful greens, vegetables, fruits, blueberries, kale, a lot of that has antioxidants. So if you're just eating a rainbow of colorful vegetables and fruits, you're probably getting your antioxidants. The next is a low inflammation diet. So that means avoiding processed foods, avoiding trans fats, making sure you're getting a lot of vegetables, healthy fats, some nice clean proteins, things like that. In terms of sunlight provides us vitamin D, so you got to make sure you're getting at least 15 minutes of sunlight, no sunscreen. You don't have to go out in the middle of the day, but at least get some sun on your skin, as much skin as possible for 15 minutes a day. And then try to get 8 hours of sleep. It'll really help with your overall well-being and then even down to the cellular level when it comes to tissue health. The next thing is treatment. So treatment can be active release techniques or it can be another modality, but it's a treatment that's designed to break up the adhesions so that the tissue will have a higher capacity. It will have the motion that it needs, it will have the circulation that it needs, and it will be able to function as desired so that the biomechanics of the area are in place. When a client presents to my office with knee pain, I will do an exam of the knee, the hip, and the foot to determine exactly which structures are involved and have adhesions. I will then use a combination of active release techniques and chiropractic treatment to reduce the adhesion and get them back to the activities they love.